All right, let's move on then. Thank you very much, Aquaponics Project. So next up is the Free Trade and Disease, a Study of Experts.
So as Professor Dorn mentioned, we are the Free Trade and Disease Group. I'm Colby Gilbert.
I'm Kieran Joyce.
I'm Julia Noel.
I'm Jim Zickel.
We approached both our project and this presentation as follows. First, we identified the problem we wanted to solve, which is stated in the next slide. Second, we introduce our methods, which are focused around our Delphi study. Next are the findings we collected from the surveys within this Delphi study. Last are our deliverables and recommendations. The problem we chose to address in our project is that during times of pandemic or epidemic, transport routes and areas of free trade help to facilitate the mass spread of disease. However, completely shutting down these routes has extreme economic consequences. The problem we are attempting to combat encompasses the intersection of trade and disease. This is why we chose experts in both of these fields to include in our Delphi study.
So our project can be thought of as a balancing act. On one hand, we have brought in professionals from the health sector, while on the other, we have brought in professionals from the transport sector. And in doing this, we hope to create collaboration between both sides to create methods that would decrease the spread of disease while not affecting trade in a major way. At the start of our project, we identified three main objectives. The first being identify major weaknesses in current practices and implementation plans of prevention initiatives within free trade areas. The second objective was design best practices and guidelines for free trade areas during times of epidemic or pandemic. And our final objective was to create an implementation plan.
In order to achieve these objectives, we completed a study of experts using a Delphi study. Our Delphi study was emergent, meaning that it generated new ideas. We sent out 3 rounds of surveys, and at the end we achieved either consensus, meaning all of our experts agreed, or divergence, meaning there was disagreement between our experts. The key experts which we identified were healthcare workers, such as doctors and nurses. We used the criteria that they must have 10 plus years of experience within the field to evaluate them. For public health experts, such as epidemiologists and health economists, we used the criteria that they must have a master's in public health and a PhD, or a PhD with demonstrated interest in the public health field, and have been published within the past 5 years. For our transport experts, such as company owners, we set the criteria that they must have 7 plus years of experience in the field. For customs experts, such as customs brokers or customs lawyers, we set the criteria that they must have at least 7 plus years of experience. Our Delphi study was completed in 3 rounds. In the first round, we asked a general question, leaving an open-ended response, allowing our experts to complete a brainstorming session. In the second round, we presented the results from round 1. We then asked our experts to rank each of the most popular results from round 1 in one of our general disease types. They were then given the chance to explain their rankings, and finally they were asked an open-ended question at the very end to provide any further thoughts. In the third round, we presented the results from round 2. We then developed a policy framework based off of our round 2 results and asked them to agree or disagree with this policy framework, if it would lead to productive policy development. From this, they were able to explain whether or not they agreed or disagreed and why. At the end of this round, we achieved consensus or divergence. This is an overview of our survey flow. After each round, we identified the common threads in the responses. Then we identified outliers. From there, we were able to use both the common threads and the outliers to develop the questions which we wanted to ask in the next round. We then structured our questions and fed back the information from the previous round to our experts through the next round of surveying. This is an overview of our Delphi timeline. Each round was open for about a week, which left us time at the end to complete the analysis of the data and develop our recommendations.
Our Delphi study has a main takeaway from each round. In the first round of data collection, we found the creation, emergence of data and ideas. In the second round, we found a diversity among answers and ideas on what is best. On the third round, we ordered and structured our previous data and input to create consensus. Now, getting into each round, in round one, we asked what measures do free trade regions need to include in their free trade agreements to minimize the spread of disease without substantially impacting economic trade during a time of outbreak, epidemic, or pandemic. Some of the most common responses are shown, which include PPE, decontamination zones, limiting free trade of essentials, and modes of transmission. Other outlier data not included in this cloud include emergency management plans, provide information for workers, and triaging.
Next, we will go into our round 2 data. In round 2, we asked our experts to rank the measures from round 1 in 3 different types of disease categories. We did this because all diseases have different ways of transmission, and so we wanted to find best practices for each. The first category we showed was bloodborne diseases. This includes HIV, AIDS, and hepatitis C. The next category was respiratory diseases. This includes influenza, measles, and COVID-19. The third and final category was vector-borne. This includes plague, malaria, and Zika. Our graphs are set up so that it is in descending order from left to right, meaning the tallest bars are the most highly ranked measures voted on by the experts. In the bloodborne section, personal protective equipment was ranked the highest measure, followed by decontamination zones and disinfecting common workspaces. In the respiratory data, personal protective equipment was also ranked number 1 by experts, followed by disinfecting common workspaces and the streamlining of information to essential employees. In the third section, vector-borne data, personal protective equipment was again ranked highest by experts, followed by decontamination zones and the streamlining of information to essential employees. Besides the rankings, we were able to pick up important takeaways based on the comments and explanations from the rankings. The first we noticed was the comparison of decontamination zones versus disinfecting common workspaces. When an expert mentioned both of these in their explanations, they often use them interchangeably, but when an expert only talked about decontamination zones, they were talking about something completely different, which was said to be much less viable. Another thing we noticed was that experts said that in order to companies should have a safe place and available treatment for essential employees that may come down with symptoms. Another takeaway was the answer of restricting trade to essential goods. In the first round, this was brought up by many experts, but when it came down to round 2, when other options were presented, the restriction of trade to essential goods was ranked lowest in all 3 categories. And the final was the difference between limiting human-to-human interaction by automation versus social distancing. In the ranking, limiting human-to-human interaction by automation was ranked higher than social distancing in 2 out of the 3 categories. But when it came to explanations, experts seemed to prefer social distancing over automation.
In round 3, we took the data from round 2 and created a policy framework to feed back to our participants, asking if this framework would produce productive policy development. From some comments on round 2, bloodborne disease was broadened to contact-based diseases, and what decontamination zones were for was specified. All participants agreed that this framework would produce productive policy development. On top of that, a few participants had additional comments. First among them was that a set of general recommendations should be given to allow a triaging period to occur. This period would allow governmental organizations to assess the needs of their people and take appropriate action. Secondly, a reliable source of information is needed to keep workers up to date on a developing situation so that they can stay safe. Finally, one participant pointed out that the effectiveness of these measures depends on resource availability and the compliance of people. This participant pointed out the current COVID situation as a prime example.
After completing our survey analysis, we were able to develop a series of recommendations for both transport companies who can facilitate them within their own facilities, and for private or public health organizations. Our recommendations are delivered in a hierarchy of measures. This means that each level must be implemented before the next can be implemented. Therefore, fundamental measures must be implemented before focused measures can be implemented, and the focused must be implemented before the advanced. Our fundamental measures are made up of personal protective equipment, or PPE. This can include gloves, masks, face shields, and full body suits. Information is also a fundamental measure. Providing a clear chain of communication is essential for the prevention of the spread of disease. Additionally, disinfection is on the fundamental level. Disinfecting common work areas routinely allows for a basic level of cleanliness to be set. The focus level was divided into 3 categories based upon our general disease types. These categories include a measure for each disease type. For contact-based diseases, education is an important measure. In the case of HIV/AIDS, it is important to educate essential workers on what high-risk behaviors are, such as unprotected sex or intravenous drug use. If they are educated about these high-risk behaviors, they'll learn about the prevention measures which they can take with regards to them, and also that they are high-risk behaviors. For respiratory diseases, social distancing is an important measure. Social distancing has been seen to decrease the spread of disease through droplet-borne transmission. For vector-borne diseases, decontamination zones are extremely important. By isolating cargo, there is the chance that a vector will be able to die, and then it also allows for an extermination period to be taken to exterminate the vector.
Advanced measures are at the top of our hierarchy. We consider these to be advanced as they require both fundamental and focused measures to already be in place. First is treatment of essential workers. By providing treatment for these workers, it will make them less worried to report themselves for showing symptoms. Second is automation. This would be put in place at border crossings and customs checkpoints and would decrease human-to-human interaction. Last is monitoring and tracing the spread of the disease at these border crossings, which will help identify where the disease is most prevalent. Our implementation plan includes what is needed to put our fundamental measures into place. These measures should be used every day and not just during times of pandemics. First is the everyday use of PPE. In order to do this, a strong and reliable supply of PPE is also needed. Next is providing essential workers with up-to-date information. This is achieved through developed and open channels of communication. Last is the disinfection of common workspaces. This includes weekly disinfecting that can be scaled up during times of pandemic.
We suggest 4 main paths for future research. These include specialized surveys that delve deeper into the 5 main fields that intersect in our problem. These fields include trade logistics, custom law, economics, public health, and healthcare. This will allow a deeper dive into each field's strengths that could be compared and analyzed later for intersection. Another topic is alternate supply chains. The ability to send resources through an area or from another area could become compromised due to a disease. A country that is well prepared with alternate supply chains increases the robustness of their economy and allows them to act better when they have appropriate resources. The third topic that people could analyze is the advanced topic section of our recommendations. These topics, including treatment, automation, and monitoring, need more research and discussion before they can be implemented. The final topic of research we could recommend is the evaluation of our current recommendations. This could entail either analyzing the effectiveness of these methods once in place or evaluating these methods with a new group of experts or other method before implementation. We would like to give a special thank you to our advisors, Professor Joe Doran and Ken Stafford, for helping us throughout this whole period, and the participants of our study who helped to make this research possible. Thank you. Are there any questions?
Great, thank you very much. So are there any questions?
Hi, my name is Bill Damaris. I have a question. I have a couple of questions, actually. Did you have a chance to look at the different modes of transportation? So for example, I would expect a ship crossing the Atlantic to have different needs than an airplane coming across the Atlantic. just given the time that it takes each one to cross. Were you able to get a sense of the differences in modes of transportation in your data?
So our study actually focused on the interior of a free trade region, and in our background research, we delved into the East African Free Trade Zone and also the European Union. And because we did a lot of research on those, our research primarily focused on land transportation for goods.
Okay. Thank you.
Thanks, Bill. Any other questions?
I have one. What was it like working on this project with everything that's going on with the pandemic right now?
Julie, you can go.
I think it's definitely been interesting. I think one of the biggest things that when this project was in part inspired by our previous study, which was focused on the transport industry and then also the current situation. So I think when we first started, we were really excited about it, and something we didn't necessarily realize was that the people who we were going to be surveying were going to be the people who were dealing with the current pandemic. So I think that personally for me has been one of the most interesting things, and definitely a learning curve on that basis in having survey response and how to get those responses.
Yeah, and actually my second question was along those lines. Is there a way of telling, or if there's any, I guess what I'm thinking is that you're asking people during a pandemic, could that have changed their responses? If you'd asked them before the pandemic, you might have gotten a different set of responses, right? I know right now PPE is top of mind because nobody has it. Do you suspect that would have been the #1 issue had you done this survey before the pandemic? What influence does the pandemic have on your survey, I guess is the question I'm asking.
I think that for the healthcare people that we had respond to our survey, that PPE probably would have been at the top for them still. But for the transport people who aren't as versed in kind of PPE and how to deal with disease, it might not have been at the top of their minds when they were answering if COVID wasn't going on.
On top of that, I think something that's really interesting was actually in one of our responses, somebody commented saying that the survey reminded them how important in this exact time communication was. So it was interesting to be like, in every one of their responses for one of the rounds of the survey, they were like, this actually reminded you I need to like work on my communication skills during this pandemic. So that actually was really exciting to see within the survey.
That's great. Any other questions?
Yeah, hey team, this is Curtis Abel. Well done, very inspiring in terms of your findings. I have a question in terms of why did you use a Delphi study as opposed to other methodologies? What advantages does this type of study give, and what are the disadvantages of it?
So the advantages, obviously, of the Delphi study is we're enrolling experts who understand the field. This was an emergent Delphi study, which means, through our background research, we saw a big gap in knowledge in what we were asking. So all of the ideas or all the actions to take hadn't been laid out yet. And, we come from varying backgrounds, but we still don't have all the answers ourselves when we were getting up to this question. So by posing as a Delphi study, we allowed the experts to feed us things they've encountered, and things they learned from being an expert in their field, which then allowed us to start the conversation.
I think also with the surveying versus completing series of interviews and things like that, the surveying allowed us to really spread it among a wide variety of experts, because I know from the transport industry, we had a bunch of experts from different countries, and even within our public health experts, we did have an expert from another country. So I think it really allowed us to broaden the reach and allowed us to really also get that intersection of the different fields versus completing interviews along those methods.
Also, a difference between the interviews and our study is this allowed for much more collaboration among the experts. Because if we were doing interviews, it would be one-on-one with them. But with this study, we were able to take all their answers, build another study, another survey rather, and then have them all collaborate on each other's ideas, and then continue to do that, just continue for them to collaborate with each other on what would really work.
I think a definite disadvantage was the unsurety throughout the whole process of whether or not our experts actually were going to agree in the end. You know, in setting it up, you, in some ways at certain points, it definitely felt like you were at the whim of what they were saying. And so there was always that uncertainty, but, you know, it definitely worked out in the end.
Oh, that's great. Great explanation. Thanks. Appreciate it.
Great. Ken, anything to add?
Yeah, I was just going to say one thing about oftentimes when you start research, you come up with a thesis, you know, how you think you predict the answer. And of course, the whole thing about Delphi is that you don't really know what the answer is going to be. So in terms of that, tell me, what was the most surprising thing, or what surprised you out of this study that you had not expected to see?
I think one thing for me is all along in my mind, I kind of was thinking, oh, it has to be, I was so like in my mind, I was like, it has to be specific modes of transmission all of the time. Like you can't have like just a generalized thing. And I think really going through this whole process and at the end, seeing that actually it was the best way to put in this generalized idea of these basic fundamental measures that can be implemented regardless of the type of disease that will still have some effect and give you a period where you then can learn about the disease and be able to implement these higher level methods such as the focused measures or the advanced measures that can really help prevent that once you learn more about it. So I think that was kind of the most surprising thing for me based on my previous assumptions before coming into this.
I think for me, actually, the most surprising thing is that there actually is something I could do. You know, when I first approached this problem, I saw, you know, there's this, you know, I'm looking at all of these governments and all this stuff, and I don't see any information. Like, how am I the person to have been able to find the missing spot, so to speak? And well, definitely surprised me. I was happy that we actually were able to find something.
Good answers. Thank you.
Great. Well, thank you very much. Nice work.
Thank you.
Thank you.